Good morning, everybody, and thank you so much for joining me with Coding with Christine Hall. I have my good friend, Jennifer McNamara here. She is the Director of Education for OncoSpark. And I asked Jennifer to join me today because this season on Coding with Christine Hall, I really want to talk to specialty coders. I really wanted to share what specialty coders do. And when I was talking with Jennifer, she's like, I love orthopedics. And I was like, oh, maybe I don't love it as much as you. Can you please come and share it with my friends and with, coders out there? And let's have a chat about, how did you get into orthopedics, Jen?
Well, this is a funny story. Like when I first started coding, I was green, and my first even thing that they even gave me to do as a certified coder was radiology. So I was just diagnosis. They started me out small. Like that was baby steps. I was doing that. And so then it came the time where my husband and I decided we wanted to move closer to my family. And so I was like job hunting, right? I'm a new coder trying to find a job. So I'm like applying everywhere. And I did actually get an interview with the VA hospital. It was a little further drive than I wanted, but I was okay. It's a real coding opportunity. I went on the interview. They hired me. Like I was ready to go. But in the meantime, I had another interview at the hospital that was a little closer in. And so it was more appealing. So I just went. It was in cardiology office, but it was just billing. And it's what I knew. Like I was like, that's my wheelhouse. Whatever specialty it is, I can do billing. Like I'm all over the place. I can do that. Good customer service. I can talk to insurance companies. I can do that. And then she's like, you know what? You're just overqualified. You're a coder. And I had to explain to her, I'm a new coder. So I was like, but I said, I appreciate your confidence in me. Anyway, she goes, across the hall, I have a friend and she needs a coder so bad right now. And I was like, can I send you over there and just talk to her? And it was an orthopedic practice, which at the time it was like really intimidating and like, orthopedics, really? Oh my goodness. So I go in there and just be myself, I guess. And I was just telling them what I had done and what I know and all that. Got the job like crazy. And I'm just like, what is happening?
So were they advertising for an orthopedic coder, or did this
I'm sure it was there. It just wasn't on my radar because I wasn't going to just go for that right off the bat. I was looking for something a little bit more, I don't know, in my wheelhouse that I knew already, but I wasn't scared of a challenge. Obviously, I've never been scared of a challenge, but so I took it on and I realized, okay, like I'm not going to be able to do this on my own. I mean, I still reached out to people my mentors.
Right.
I'd ask them questions, but there was someone in the office doing the coding already. She wasn't a coder, but she was studying to be a coder. And so she knew things. And then the receptionist actually knew a lot more than anyone, even though she wasn't a coder, which is so true these days. It's like most receptionists, those in the small offices, like they just know everything about that physician. They know everything because they are there every day. They're seeing the patients come in. They know what's going on with them. It's just, and they're on it. So she taught me a lot too, even though she wasn't a coder, from a billing standpoint, like how they do things, what the doctor means when he says this. So I learned that physician's documentation. And over time, it just got easier. And he was such a great, to this day, I still text him, asking questions. Like I called him the other day to get a quote from him for an article. Like he's just such a great guy. I love him to pieces. And he was my first experience in the OR was with him. Like it was just such a cool
experience. To go into the OR?
I did.
I love that. I did that in a cath lab one time with a cardiologist I was billing for. Not a cardiology coder, just kidding.
Just to say, no. So like I was asking him, I always had a good relationship. If I had a question, I felt comfortable. I could go to him, like walk back there. Can you clarify this for me? Is this what you mean when you said this? I just need some clarification on this coding. He knew coding pretty well. So he was a great resource for me as a new coder. So we communicated a lot and he was a great educator. So then he's like, hey, I think it'd be beneficial if you just come with me in the OR so you can see me do stuff. And I asked my first question, am I allowed to do that? It was like the first thing I thought. I'm like, I'm not like clinically, what do you have to, I don't know anything. Like, how do I even get to this position where I'm allowed in there? Oh, it's easy. Just tell Kelly and she'll get you signed up and they'll figure it out and get you scrubs and you'll go in. And so like I went in and I scrubbed in and they walked me through everything. And I got to, it visualized a hip replacement, a knee replacement, and a shoulder scope. It's like those 3 procedures I was able to see being done. And I will tell you, the night before, I was a little nervous. I'd never seen the human body opened up before in the live environment,
Right.
especially surgeries like that. So I was on YouTube, like just preparing myself for like what I'm going to see, right?
I've done that. I've had a lot of, unfortunately, I've had a lot of surgeries, and between my husband and I, and we will do that. We'll geek out like the night before surgery and pull up all the YouTube videos and look at them. And so we were mildly, novicely knowledgeable about the procedures we're going to have. And I had my very last surgery was on my hand, and the hand surgeon asked me, "Do you want to be awake?" And I was like, "Oh, yes, let's do this."
I want to see everything you're doing.
It was awesome. We got to play with the hand tendons and
Christine, I don't know if I could do that, but man, that is funny. Oh,
he's like, "Okay, now bend your fingers. Look at this. Wow." And he pulls the tendon out of the the cavity of the hand. And I was like, "Oh, this is incredible."
Yeah. Well, for me, it was so funny because it's interesting. Like you're trying to like stand in the right spot because it's all sterile environment. So they told me where to stand, and I was above the patient looking down when they were doing the hip surgery. And like, man, I'm so glad they have anesthesia. They're pounding that nail in there, and I'm just like, oh, so crazy. And then at the end, like for me, it was so cool. Like for me, I thought it was fun just watching them put the patient back together again. Like I told physician assistant Stephen, I was like, man, I think what you do is cool. Like you can just sew the patient back up. I just love watching you do that. It was really cool. But anyway, so it was a great experience. That taught me a lot. And, from there, I just didn't say no to a challenge. And even I've been at orthopedics about that long, over around 10 years now. And then in the meantime, of course, I was able to do other specialties like general surgery, GI, and now I'm doing, of course, cardiology a little bit, and I'm doing plastics. So kind of, I think all of us have this goal of just knowing as much as we can so we can be useful and helpful, which is where that attitude being in healthcare comes from. You want to help people, whether it's helping the doctors get paid, so the patients, of course, obviously can still get their services. It's all full circle. So
it's so wonderful. What is your favorite orthopedic codes to code? What did you fall in love with?
There's so many, as you know. And as I dug in deeper, I was like, because I didn't enjoy, like at first, I didn't enjoy the integumentary stuff. So I was like, whenever I had to code that for ortho, I'm like, oh, like I don't even know where to start here. I'm like,
debridement and that kind of stuff.
How do we know when I can do this and this? So I learned it. But after that, I realized how many specialties use it. Like even when I got in general surgery, obviously they always use it. Plastics, they use it. Podiatry, they use it. So all the places I've ever been, I've used them. So I'm like, okay, Jennifer, this isn't going away. You're gonna have to deal with it. So it was great. And now I'm excited. I was just quoted in an article for debridement. Like they called me for a quote. And so I feel like now I'm considered, I guess what you would say, an expert. I mean, I've learned a lot and I want to share it. So that's what I'm here for. But as far as codes go, I've developed a good love for spine coding, actually, the ortho spine. I really enjoyed it because I love digging the documentation, and I love seeing how my anatomy brain, my ICD-10 brain, all of the things that I know come together and I like to see it all come together. So when I'm looking at, the note, I'm looking, okay, like, did they do this? And I know specifically I have to have these general codes. Like there's usually 3 or 4 types of things being done at the same time in my spine surgery.
Yeah.
But and my biller brain is always there because that was what I was first. So I always go back to LCDs. I go back to what does the insurance say, which I don't think enough of us do.
I was going to ask you that. What are your favorite resources for coding or billing? What are your favorite resources there? So I was going to ask you about LCDs and.
Oh yeah.
They turn me on. I'm not going to lie. I really like LCDs.
Same.
I find it a great place to start with knowledge. Even if a specific payer doesn't have a policy, I'll find an LCD to kind of guide me. Not that I will hold them to that fire, but that will guide me in looking for that medical necessity, looking for the contraindications, looking for things like that.
Oh, I
So,
agree 100%. And that's why I was just telling, I did a presentation for Palm Springs AAPC last night. And what's one of the things I always say is that you can learn so much from the LCD policies. So like, if for instance, when a physician would ask me, you know, where's your backup? How did you know, where did you get this information? I pull it up because, and a lot of them may not realize this, but when you go into the policy specifically, they have notations and citations on where they got the information. And most of the time it's from their organizations that they go to, like for instance, AAOS or another organization for their specialty. And their Medicare is very transparent. Like they give you everything you need. So I like reading it. They give you coding guidance. They give you documentation guidance. Like, so there's nothing on the table left on the table here. They are completely showing you everything you need, you know, like silver platter right here.
Yeah,
You just
no, I
need
couldn't agree more.
take it. And so I learned a lot from coding from that. I agree. And then if it's Blue Cross, I'll log into our local Blue Cross, wherever state I'm working at.
Right.
And I will type in the code and I will say, is there a policy on this? And then I compare it, you know. Most of the time though, you probably agree that most payers follow Medicare, and you compare.
They mirror each other quite a bit. Absolutely. And I think it's because, you know, Medicare does the work. Even when we talk about RVUs and RVRVSs, and we talk about policies and limitations and where it comes from, like they do their work and they give you the reasoning and the explanation. But Medicare also gives you the opportunity to comment, come back and say, you know, I'm a orthopedic surgeon. I'm not really digging this. I see where you got this information. But so at least Medicare allows that comment and consideration of the comments. So I love that part about CMS and what they do for us there.
Absolutely. And as far as other codes go, I guess the things I enjoy coding the most are like knee surgeries and shoulders. So knees and then hips, hips, and shoulders. Those are my favorite outside of the spine. I mean, I will say the hands and feet are, I'm a podiatry coder and I love that. But when it gets into like the intricacy of the toes and the fingers, sometimes it can be a challenge. And it's not like I'm afraid of it. It's just not my favorite. I know how to do it and I know where to go if I have a friend named Jessica, and she's a hand coder. Like she is my girl. And so if I am not quite clear on this specific piece of documentation, I'll say, they said this. Does this mean this? I will just ask her, because sometimes it's there. And as coders, we just think, okay, if it's not word for word in our book, it's not there. It's not the case. Yeah. It's not going to be word for word every time. So we have to think like a physician in some ways. Like we have to know what they're trying to say here, because we can appeal it without wording and we can stand behind it even with that wording, because it's there. It's just maybe we don't know that it's there. Right. Until we know it.
I'm glad you mentioned Jessica. My friend Caitlin Brock has been on this tour of talking about networking and explaining how we connect with each other and we can utilize each other. And I remember back in the day, I used to feel bad about reaching out to somebody. I don't want to bother them, or maybe I should know this. And maybe it's age, maybe it's the times. Forget it. I'm going to pick up the phone. I'm going to say, hey, Jennifer, I'm auditing this spinal surgery, and show me what the pitfalls are. What should I be looking for? Or, you know, what are the nuances that maybe I need to catch? And it's nice to be able to do that. Or like you said, call Jessica on the phone and say, hey, Jessica, there's a hand surgery here and it's a little weird. And can you kind of walk me through this? Because I think I made a post the other day. We can't know everything. We will never know everything.
No. At least not simultaneously.
Well, not in this industry.
No, I mean, absolutely not.
The last 3 years that I kind of call them the COVID year, because I think 2021 and 22 are kind of all blended. But we learned so much that we need each other. We need each other more than ever. And we have all these new outlets that we can communicate with each other. So I'm excited to hear that you too, even as seasoned as you are, as experienced as you are the expert, that you still feel like you can reach out to people that have those other specialty resources. And I want to encourage all the listeners to build your network of people that you can reach out to, and you can say, hey, this is not, I had an audit go kind of crazy the other day. It was started off as being a psych audit, and it turned into being an IOP, an intensive outpatient program audit, which is not my favorite thing to do. I did it years ago, and I didn't do it again for a reason. But I ended up having to reach out and phone a friend and say, guide me, give me some tools here to work with so that I can be successful. Yeah.
Yeah. Well, I see a question from Pam. Are you okay if I answer it?
Oh, please. I can't see the questions. I don't know if anybody noticed it. I'm on my iPad today. My
Okay.
computer, that is weird, is being uber weird today. So yes, please, Jennifer.
Well, she asked if she knows anyone that has a breast surgery or knows breast surgery. I mean, that's me, girl. If you want to reach out, I mean, it's one of those things I kind of just fell into a couple years ago, and it was always something I did in general surgery, but not as much. And then when we got the plastics clients, it was just all breast. So it was like, so now it's all we do that every day. So yeah, I mean, definitely reach out if you have a question about breast, and then like I said, I simultaneously covered orthopedics and general surgery. Those are my two wheelhouses that I live in. So yeah, we're talking about orthopedics today, but if there's any general surgery questions, yeah, I'm here as well.
Awesome. Good to know that. So now let's talk the dirty. What are the codes that you're not really crazy about, or, maybe even diagnosis or modifier? Where's your pet peeves, Jennifer?
Well, there's some gray areas that just kind of come into, and I wouldn't say not my favorite, but I'm going to go with denials. Like, I don't have like a not favorite code, because like I said, I don't get scared of codes. I'm just like, okay, I need to understand this better. I'm not going to say I don't like it. I'm just going to say, okay, like, I need to dig into this deeper and figure out why these don't fit together, which is why I love denial so much. I love
CO50. That's the denial that makes me crazy. CO50, medical necessity.
Yes. Because and like I said, you don't know this. Most of these denials, like 90% of them are avoidable.
Right.
If you have the forethought, the knowledge, and communication skills to communicate with your provider, they want to know just as much as you do. If they're going to they don't want to keep doing something if they're not getting paid, right? I mean, why would you keep doing that?
We talked about that yesterday. I did one of the first lives. Was it the first live this year? No, it was not the first live.
No, you did that in January too, remember?
Okay, I did 2 lives this year. So my second live was yesterday, and it was on denial management. Mm-hmm. So you're right there with me.
Absolutely. And so one particular area that I always cover, and when I was asked to speak at Decision Health in Orlando last year, which is of course why I was there and why we got to have dinner, was whenever it was the knee procedure. And like, Terry and I, like, we are on the same wavelength here. Like, she's ortho just like me. And so we love to talk about this whole like knee arthroscopy NCCI issue, because it's just one of these things that like people just don't understand with the chondroplasties. So it's like my favorite thing to, like, on a denial, explain why this is denied and why you didn't put the right modifiers, why you unbundled inappropriately. So like, it's not just CPT says this.
Yes.
It's also NCCI says this.
Yes.
And what we're finding, and I did a free webinar for orthopedics recently, just to kind of talk about some of the common issues, and that was what I talked about. And my biggest thing is read the NCCI manual word for word in that paragraph. Yeah. Like, there's so much room for misinterpretation in that paragraph. And when I read it, I'm like, okay, I think they misinterpreted this sentence right here, because that is exactly what the common issues are. They're misinterpreting the use of the G code that Medicare has. There's a G code Medicare has, and it's easy to misinterpret it so much. And so when we really dig in and we read it carefully, read the fine print, it's there. Everything we need to know is there. It's just, we got to stop. Is there a period here? Is there a comma? Like, is there a parentheses?
When I'm teaching CPT, I can't stress enough plurality, or not even just CPT. We saw it in the 7th characters in ICD, when we're looking at the A and the D for initial and subsequent. If you look, the subsequent has plurality. It says encounters. Mm-hmm. It doesn't say encounter like today. It says encounters.
That's a really good point. I love that. That's a good
plurality. is a big one. When we're selecting our CPT codes, some of them have those parentheses around the S to indicate that it also has laterality or plurality. Like it's pretty interesting, but that you mentioned that in the NCC, look if it's a comma, look if it's a period, because there's a motive to the madness there.
Well, even in CPT, they have a little S, the parentheses around it, which makes you, so you know what that means. Like, and if you don't know it, then you learn it, or you can ask a question. If you don't know what something means in your book, look it up, research it, or go to someone that might not have the answer. And so you can start adding to your knowledge bank. And that's what I did. Like, I didn't know it all at once, obviously. It happened over time, but I know enough now where I can be like, okay, this doesn't make sense to me. I'm going to reach out and see if I'm thinking about this correctly and clarify it with someone that might know, just because like I'm thinking this way, but I don't want to know. I want to know if I'm right or if I need to go a different route.
Exactly.
So, there was a question here. I think, of course, it's E&M, and we both love E&M.
I love E&M. Yeah.
So it's, what is your suggestion using Modifier 57 with surgery inpatient consults? Well, that's a good question. And actually, last night, my topic for APC was E&M only modifiers. So I did talk about 57 a little bit, and it's really just understanding the modifier, right? Like, you want to understand its purpose. And, when you look at Medicare, is definitely look at the manual. They have a great global surgery packet.
Yep.
All their packets are great.
Yep. But they have a good MLN.
Yes. It's my favorite. All their booklets. I have all their booklets. And if I can find a Medicare booklet, I save it because it's just everything you need right in this clean cut little document. So when they talk about it, they'll explain to you, that it includes obviously the 90 days of surgery, but it's 90 days after the surgery. So the surgery is day one, got 91 days, but they also include the day before.
Right.
It's for
it's 91 days, actually.
Yeah. So it's like, you have to know, okay, so that's why you add the 57 to the date that you made the decision. And that's the key that people I think it's confusing for physicians. It's when you made the decision, right? So you made the decision on this day. I had an example in my slides that I used. It was a little trick question because I said the physician saw the patient on March 10th, right? They just said that if the x-ray tomorrow doesn't show any improvement, they're going to go ahead with the surgery on the 11th. So I asked them, okay, which code do we add the 57 to? Because it goes on one of these dates. Which one does it go on? And so I asked the questions, and it wasn't the 11th, obviously, because the decision was made the day before, but you can still add it to that date because you can do it if they're having the surgery the day after. You can put it on that decision day as long as it was the day of or the day after you do the surgery. So those are things to keep in mind because really it's all part of the global package. You're just trying to tell them I'm unbundling this for this reason. Right. I know that's part of it normally, but in this situation, I want reimbursement for this service I provided that is within the guidelines to be reimbursed for. So
that's tough. It's tough for a lot of people to try to understand that. What is the right date? What isn't the right date? We have so many rules and there's just no way to know all the rules all the time, but we're still going to be, I don't want to say the word judged because that's pretty a harsh word, but we still have to follow those rules in coding and then subsequently in billing to make sure that we're really getting paid what we should be paid.
Absolutely.
The correct way. So,
yeah. I mean, there's lots of questions with E&M. Like, there's so many little gray areas, even that come into orthopedics when you have to deal with like your mid-levels and understanding like what they can do. And if it's a consult, you're the consulting physician, obviously. Surgeons usually are. And then you have the admitting doctor. And so trying to maneuver through Medicare's rules. Back in 2010, when they dropped the consults off the list. Right. And I remember I was not a certified coder yet, but I was a biller. And we had a meeting, all of us, the director had a meeting to remind us of this new thing that happened. And then the AI modifier.
Yes. I remember I had a billing company at the time that all of that happened. And I thought, oh no.
No, what are you doing?
I have to re-educate all over again.
Yes.
There's new.
We roll with it. And look what happened this year, right? I mean, all of these, every year we get new modifiers, it seems like.
I know we did. We got all of those F modifiers and we got a whole bunch of new modifiers this year. And have you peeked at 2013 or 2023?
You mean like the E&M stuff?
Yeah. Did you look at the E&M stuff yet?
Oh yeah. I mean, it's been on my list all year. Like, so
Yeah.
since they dropped it last year, in February of last year, it's my radar. And so every time I
Yeah.
do E&M, I do like a little 2-slide thing on what's coming in 2023, because I'm like, it's about time
Yeah.
that it goes with 2021, but it still is something that I feel like should have been done a long time ago.
Absolutely.
2021 guidelines in general, I feel like should have happened sooner, but they're here.
I know. And we never stopped talking about it. I presented on Monday night about E&M still. And I think the more that we talk about it, the better it becomes, the easier it becomes. And I know that we've got a lot of changes. They just had their symposium. Was it the symposium, or was it just a meeting that they had, AMA had about?
I think it was just one of their meetings.
Yeah.
I'm not sure when the symposium is. I think it's this summer, right? I forget when we have it.
But they just had a meeting not too long ago. My friend, Kimberly Jolivet Williams, she was invited to just be a fly on the wall.
Oh, one of my favorite girls too.
Yeah. And so she was sharing with me some of the things that she heard during that. And I'm so excited. I'm a little nervous, but I am very excited about 23. I think it's going to be an amazing year. I did take a peek at the IPP, the inpatient proposal that came out, looking at all of those new ICD-10 codes that are being proposed. That was incredible. Definitely a big increase from what we saw in 22. Yeah, so that's a lot of fun. So Jennifer, before we wrap up, I wanted to ask, what advice do you have for my friends and colleagues that are thinking about going into orthopedics or, podiatry, general surgery, any of those things? What words of wisdom can you give them?
Well, just keep learning, be a lifelong learner, and you're not going to know it overnight, but, know your resources, the authoritative guidance, obviously your books. I love my encoder, but I don't use it to code. So please use your books, because especially ICD-10, you cannot get to the right code without using your book. It's just almost impossible.
Yeah.
You got to go from the index to tabular. It's the way it's designed for. But then you have, all the references. I think people just don't know how to use our books appropriately. So when it comes to like the appendixes, for instance, the HCPCS manual has some amazing appendices that we just never think.
Yes.
It has the NCCI stuff in the back.
Yes.
It has Modifier 59. It has all this billing stuff in there. It's Medicare's manual, I call it, So I say, go to the back of your HCPCS manual, have it tabbed. It's your best friend. Use it. There's that, of course, coding clinic, AHA, AHIMA pushes that because they're one of the cooperating parties of the ICD-10 guidelines. So that's an authoritative guidance. CPT assistant for auditing, we don't necessarily call it one, but it does have great information, and it will kind of lead you into maybe the right direction or give you some
examples.
Guidance.
It's got good examples.
Yeah.
I like to use the examples that I see in the CPT assistant, because sometimes those are written that they're easy to understand.
Right. Someone wanted to ask a question about where we can find the updates for 2023. I don't remember. I have the link.
They're not officially published yet.
Yeah, they're just on the AMA's website. They had like their meeting. Then you could download it. Right. If I can find it, I'll send it over to you, Christine. But
that'd be great.
I know I still have it somewhere. It is like somewhat published. Like you can find it. It's just hard to get to our website. Yeah. It's not like easily found. So
send that to me, and then if anybody has any if you need that, just you know how to get in touch with me. You can either reach out to us on any of the social medias.
But it's coming. We're already in May, so I would imagine the next several months, at least by September, October, we're going to have some.
Oh yeah, we'll have all the CPT by then.
Oh, Betty is good. Betty's got you.
Incredible.
Betty, look at her. Yeah, absolutely. There she is. Well, that's great. Yeah. Well, I love, orthopedics. I love everything I can think of, when it comes to that specialty. And recently I've been connected with some orthopedic surgeons on LinkedIn. And I don't know if you guys have been on there, but like there's this movement. There's these surgeons that are getting on TikTok. Have you seen this?
I haven't. Oh my
God. It's so amazing. So, okay.
I'm not quite TikTok savvy yet. My husband is, so it'll happen, I'm sure. But
I love my ortho. I love all surgeons. I love picking their brains. I don't want to be their best friend. I want someone to be their best friend, but I want to get to know them, and I want to get to know how they think. And that's not only because it's my job, but also because I'm fascinated with what surgeons do. And so it was funny. Like there was this physician I worked for, but not direct. Like he never met me. It was remote, and I knew his name. And so I'm in Nashville last year on my way to Florida, and he's all over social media. He's also one of the surgeons that's on TikTok, and he's hilarious. He's super fun. And so I walk into my hotel and I look over and I swear I see him. And I'm like, I called out his name. I was like, Dr. Calendine? And he's like, yeah. I was like, oh my gosh. And so like, I'm like fangirling out. I'm like he's a celebrity or something. And so I walk over there and I'm like super excited and talking to him, like telling him how much I just like been following him and love his posts and what his new technology stuff that they're doing. And so we just been talking, and then then I got to see who other surgeons that he's connected to, and then they're also on TikTok, and I'm like, what is this thing happening? So it's super fun. So if you love learning about like just in general medical and surgery, like find these doctors, these orthopedic surgeons on LinkedIn, find the TikToks. It's so fun to see them in the OR. Just the things that they can talk to you about. It's just really great.
That's incredible. Thanks, Jennifer. I'm going to check that out.
Yeah, absolutely.
So Lexi, do you have Jennifer's contact information? Yes. So please make sure that you reach out to Jennifer if you have any questions about what we talked about today, getting into orthopedic coding. I'm sure that she'd be happy to answer any brief questions that you might have, or at least point you in the right direction. So please, jmcnamara@oncospark.com.
Yes, and really quick, can I tell them where else they can come to see me?
Absolutely.
Because I am like excited that we're bringing back our orthopedic conference this year. So as we know, it's virtual. It's in July. So July 15th and 16th. I'm really excited. So last year we had a good showing. We had a lot of hospitals that sent their coders, which I think was great. A great option during COVID. Like we couldn't go to conferences as much. And so if you need coding, billing, compliance, best practices, that we actually have a doctor coming to talk about anatomy. So I always get
new coders would be okay to attend.
Absolutely. Yeah. That's why
hey guys, so this is it. She's just told you want to get into orthopedics. July, what are the dates?
15th and 16th. It's virtual. You can go to our website or email me directly. I can send you the right place. But it's, of course, 15 CEUs. Can't beat that, right?
Wow.
So, yeah.
Incredible. And then you also have a summit this weekend.
Yes, cardiology with Terry Fletcher. So yeah, and you, Miss Christine Hall.
We have Stacey Buck, we have Terry Fletcher, we have Betty Hovey, we have Jennifer McNamara. So I think that this weekend, the cardiology summit, any of you that are interested in getting into cardiology, want to know more about cardiology, this weekend is your weekend. Orthopedics, guys, it's coming in July. Talk to your administrators, talk to your managers. Get signed up for this. It's going to be absolutely priceless. Or like we said, if you want to transition from the coding that you're doing now, or you're billing and you want to get into orthopedic coding, July is coming up. It's sooner than you think, guys.
Oh, you're telling me, man, it's like it sneaks up on me every time I do a conference. I'm like, you're busy planning and getting speakers and putting the content together. And I'm like, oh, it's already here this weekend now. Yeah, I'm having lunch with Terry on Friday, so we're going to talk about it because I'm here in sunny California this week. So,
well, thanks so much for joining us with Coding with Christine Hall. We really, really enjoyed having you on, Jennifer. You're always such a wealth of knowledge. I really appreciate your time.
Thank you.
And I know you're in California, so it's like super, super early there. I really appreciate it.
It is, but hey, I'm on the central time zone, like physically, so it's like I'm up anyway.
All right, well, we will talk with you soon. Thanks so much, and join us next in 2 weeks. We'll be back and for another Coding with Christine Hall. Good to see you. Thanks so much, guys.
Thanks for watching.